Men's idealized versions of themselves tends to be when they're in their 20s, maybe early 30s. That's when they pretty effortlessly have better energy, good sex drive, and good sexual function. And you can't reverse time, obviously, but there is a major factor that can be reversed, which is the decline of testosterone levels. Testosterone decline is usually a gradual process, so it sneaks up on people. They don't realize it's happening. There are some guys who are 33 years old, they feel okay, and when you test them, their levels are typical for testosterone of a 50-year-old. And it's not unusual to see that. You know, I just knew that I would regret it forever if I didn't take the chance to start something that could be transformative. A lot of guys say to themselves, this is the way it is. This is what getting older means. This is how my body feels. And one day they wake up and they don't recognize the person they're looking at in the mirror. You know, it doesn't feel like them. So life may seem less interesting.
The thing that I love hearing patients say is, I wish I knew about this years ago. You know, that just gets to the heart of what this is all really about. Like, the most common answer at the first follow-up visit is,
I thought, I have to do this. It's now or never. So I resigned from my role, which was a big deal for me because it was kind of a dream job at the time, and started Fountain. Hi, I'm Doron Stember. I'm a urologist in New York.
You're like a punk doctor, dude.
There are a lot of guys who feel okay. They've adapted their lives to the new reality.
yeah, I just want a small drip coffee.
Then you start talking to them about how do they really feel? How did they feel before, 5 years ago, 10 years ago? And it's clear that something has changed. And when you can match the way they're feeling with their levels, you can find a pathway forward where the guy is going to have optimal levels with treatment and have a potentially transformative experience where he is now in control of his life. And that's what this is about. There are a number of common misconceptions about TRT. There's guys who come to me and often the partner is a little bit worried about, I don't want him to become more angry, more aggressive. And they're often surprised when I say, this guy has low T and he's probably irritable because he doesn't feel good. And the reason he doesn't feel good is his testosterone levels are low. He doesn't feel an overall sense of well-being that he should be feeling.
It's almost a little embarrassing that I kind of missed it in myself for a long time. I was actually in my late 40s and hadn't started it. I had been treating this condition for 10, 15 years. I had the classic vision of myself as being athletic and strong, and those things were slipping away. So I decided, just like I'm recommending these guys, I should get my own levels checked. So I tested myself. I had one of the other Fountain providers see me as my provider. I did the same exact process as every other patient. I got my shipment. I started testosterone with the cream, and I felt this surge of goodness. This is my personal experience. I told my wife, I feel stronger, sharper, taller. I was kind of joking, but I just felt so great.
In 2019, I was on the faculty of the urology department at Mount Sinai Hospital and treating patients one at a time in my office. And what I saw was something that really opened my eyes, which is that the work I was doing could have an impact on thousands, tens of thousands. And knowing that I could potentially reach a lot more was really, really interesting to me. I remember thinking that testosterone treatment would be the perfect thing for telemedicine. This is one of our hair regrowth formulations. I've worked it into my routine, and I've actually had pretty incredible hair regrowth myself. Yeah, so my hairline used to be like that. Comes as like a foam, you rub it in, disappears immediately. It's really easy. And then you start seeing these little tiny thin hairs, and you see a new front line. So it's really testosterone management is a way you could think of it. The patient's testosterone levels have declined, and we can give testosterone, a replacement for that testosterone, so you bring the levels up through injections or through a topical cream that we developed ourselves with a pharmacy partner. We think insulin syringes are the best option for injecting testosterone. It's the right size for the range of doses we prescribe. Really importantly, it's a really tiny needle. That is the biggest factor in having it be virtually painless. I've never had one single patient ever do an injection to himself and say he can't do it again. So you have the vial of testosterone, You put the needle in, turn it upside down, you withdraw to the prescribed dose. I recommend holding it like a pen or pencil. You basically just pinch a roll of belly tissue. I use the base of my hand to stabilize the needle. You place the needle just under the skin. You manipulate your thumb here. You slowly depress the syringe. That's it. Very simple. This is a bottle of our topical cream formulation. It's see-through on the side, so you know exactly how much medication is left. This is meant to be applied each morning. Patients are prescribed a certain number of clicks. You twist the bottom. With every click, some medication appears at the top. You can just swipe it off with a finger. This medication absorbs immediately. That's it. Very simple. With all the people I work with at Fountain, I am now able to have an impact on so many more people than seeing one patient at a time, which has been really the best thing I've done in my career. I'm very happy with that. If you know anybody who has gotten testosterone therapy through insurance, I think it's extremely likely they will tell you it was a horrendous experience and it was difficult. There are arbitrary and artificial and, in my opinion, not clinically meaningful thresholds that the patient has to meet in order to qualify in the first place.
I think one major difference between Fountain and our competitors is that I developed the program. I'm a urologist and I'm a specialist in male sexual health. Many of the competitors, the founders, are business people. They're marketing specialists. The company is oriented around that vision.
When an insurance company is saying, this is our preferred first step, it's possible it's the right thing for the guy, but he didn't decide that, and the provider didn't necessarily recommend that. You should have a provider and a patient talk to each other, discuss the risks and the benefits of the different forms of treatment, and come to a shared decision.
At Fountain, we start with the providers. We start with the program that you would want patients to have in the ideal setting.
I remember coming out into the waiting room when I was in practice and seeing a huge room full of people waiting, looking at their watches, checking in at the front desk. I would just feel so bad, and I don't think anyone should have to go through that experience. Everything can be done from your home. You can sign up at home. You can communicate with us at home. We have people 24/7 available to answer any question, concern, or request. We want to give you the ability, and we even encourage patients. You can potentially get labs done at home. Results come back typically within 24 hours. We'll message you a link to schedule a video visit with an expert provider who's licensed to see patients in your state. At the time of the video visit, you get a link, you click it, you're having a conversation about how you feel, about what your concerns are, what your goals are, what your options are. How are we going to make this work together?
I have a patient who stands out to me because he was so emotional when we met. He told me that his father, who had passed away about a year ago, was depressed. And the patient himself said, I felt like he did, but I wasn't as old and as slow as he was, but I saw myself in him. It just clouded his whole life. He realized that his father must have had low testosterone, and he just wished so fervently he could go back in time and say, Dad, I tried this medication and it's transformed the way I feel. And he was crying. It resonated with me because it's about time. Like, the most precious thing we have in the world is time. That's why I think it's so important to not just accept how you feel if you don't feel good. When there's a really simple fix, and it's accessible now. So people should just get tested, take a couple simple steps and find out what your T levels are, and talk to a specialist. If you don't know, then there's no possibility of getting better. If it's not right for you, then at least you know that. But if it is right for you, it could actually change your life.